my name is Marfilza. Hanis means is my name. You guys can call me Hanis. Today, our video presentation is about Gerd, or we know that as a gastroesophageal reflux disease. In this content of the topic, first, the introduction about Gerd. Second, background of Gerd disease. Third, explanation factor affect cause the Gerd. 4. Effective way to prevent Gerd disease. 5. How does adapting a lifestyle helps in reducing risk of Gerd? 6. Conclusion and lastly, reference. So next.
Hi, my name is Puteri. I am here to explain about the introduction of Gerd. Gerd stands for Gastroesophageal reflux. This is the medical term for chronic acid reflux in your esophagus. Gerd is a common condition in which the stomach content move up into the esophagus. This content sometimes contain excessive acid and may irritate our esophagus. Also, Gerd occurs when stomach acid repeatedly flows back into the tube connecting your mouth and your stomach. Commonly caused by acid reflux, which may result from improper functioning of the lower esophageal sphincter. Gerd is caused by frequent acid reflux or reflux of non-acid content from your stomach. This backwash can irritate the lining of your esophagus. A diagnosis of Gerd starts with a thorough physical examination, during which you describe your symptom and your medical history. For example, upper endoscopy allows your doctor to examine the lining of your esophagus, stomach, and first part of your small intestine.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is AZRINA binti Azri. We have found few background research about Gerd. According to Denisa M. Clara and Christine Hackham in 2018, gastroesophageal reflux disease, also known as Gerd, is common among us. Most of people will experiencing this with few symptoms. Advanced diagnostic and therapeutic modalities really help us to cure the disease more effectively. Next, Gerd also happen at a young age. According to Ujar Podar in 2019, almost 50% of healthy baby vomit at least once a day at 4 months old and 90% of 12 months old baby. The currency of Gerd will increase with age. 20% of cases are discovered in teenagers and adults. Last but not least, according to Jamera Uda, Sharaz Armakar and Jasper Lagergren in 2020, 20% of patients will experience heartburn and vomit in adults population. Patients who do not respond to any medication prescribed by the doctor will be monitored by using esophageal pH monitoring.
Hai, Assalamualaikum warahmatullahi wabarakatuh. My name is Puteri Nur KAMALIA Aina binti Kamal. Gerd is caused when gastric acid flows from stomach into our food pipe, which is esophagus. Hence, there are many factors that can cause Gerd. Firstly, excessive body weight. It is because extra weight on body added pressure on stomach. This can lead to more acid produced from stomach traveling up into our esophagus. But this problem cannot only happen for those who has obesity. Even slightly overweight can also cause Gerd. Some people with Gerd may getting worse when they exercise and can gain more weight. Another factor is smoking. Smoking can reduce lower esophageal sphincter, that is called LES. LES is the protective closure that keeps the stomach acid in and out of the esophagus. When the LES is reduced, this can easily cause heartburn. Also, smoking can reduce the amount of bicarbonate in saliva and also increase levels of inflammation in the body. Moreover, high alcohol consumption can cause Gerd too. When someone drinks alcohol, it can trigger acid reflux. Alcohol is diuretic that can cause someone to urinate more often. This can lead to dehydration that makes acid reflux symptoms worse. Lastly, the factor that can cause GERD is particularly obesity. Obesity may decrease LES pressure and increase transient LES relaxation, which could lead to increase the esophageal acid exposure. These are the effects of GERD. Firstly, heartburn. Heartburn is a burning sensation in the chest, usually after eating, which might be worse at night or while lying down. After that, dysphagia. It is a medical term for difficulty in swallowing. This condition might be painful.
The other effect of GERD is having difficulty in swallowing. For example, when you feel your food is sticking in your throat. This happens when acid reflux occurs, where your acid flows back into your esophagus, causing irritation and discomfort. Second is chest pain, and lastly is chronic cough.
Hi, this is the effective way to prevent GERD disease. How we can prevent from GERD? First, don't lie down after eating, because when you lie down, our stomach contents press harder against the legs. It can trigger reflux. So, after you guys eating, you guys must wait for 1 or 2 hours maybe before you lie down. Second, maintain a moderate weight. If you have excess belly fat, the pressure in your abdomen may become so high that the lower esophageal sphincter gets pushed upward away from the support of diaphragm. So, in this condition, we know as a hiatal hernia that consider the leading transocean cause of GERD. Third, don't drink too much citrus juice, because in citrus juice they have ingredients that highly acidic, such as ascorbic acid, which could cause indigestion if you consume them in large amount, and also may irritate the lining of your esophagus. Second, when you guys drink citrus juice, maybe probably doesn't cause acid reflux directly, but it could make your heartburn worse temporarily. So, four, limit high fat food. What is fat? What is high fat food? High fat food like this may contribute to heartburn by causing bile salts to be released into your digestive tract, which may irritate your esophagus. What example of high fat food? Like hamburgers, fries, sausage, and others. So, five, don't drink too much coffee. Why we must prevent don't drink too much coffee? Because in coffee also may temporarily may relax the lower esophagus sphincter, increasing the chance of acid reflux. So, six, eat smaller, more frequent meals. The lower esophageal sphincter is a muscle that acts a valve between the stomach and the esophagus. In people with acid reflux, this muscle is weakened or dysfunctional, causing acid to flow up into the esophagus. Unsurprisingly, many reflux symptoms take place just the source after a meal. Therefore, eating smaller, more frequent meals throughout the day may help reduce symptoms of acid reflux. So next.
Hello, my name is Siti Nur ATASHA binti Azlan, and I'll be presenting about the impact of a healthy lifestyle on the risk of gastroesophageal reflux disease, also known as GERD. We may not think there's any relevance between a healthy lifestyle and gastroesophageal reflux disease. However, a healthy lifestyle certainly does impact the chances of the disease happening. The question is, how does a healthy lifestyle reduce the risks of GERD? Firstly, a healthy lifestyle allows your gastric acid to be less corrosive. This is because healthy lifestyle habits like eating frequently in moderate amounts allows your gastric acid to be less reactive, as it does not need to digest a large amount of food and does not make your stomach empty for long periods of time. While not lying down after a meal allows your gastric acid to also be less reactive, and thus lowering the risk of your gastric acid rising to your esophagus. Secondly, maintaining healthy lifestyle habits also helps you lower your gastric acid level, as a healthy lifestyle assures that you eat moderately, thus reducing the amount of food in your stomach and the level of your gastric acid. Finally, some healthy lifestyle habits like maintaining a moderate body weight and limiting the intake of high-fat foods lessens your body fat content, which simultaneously reduces the pressure on your stomach walls. This also lessens the risk of gastric acid rising up to your esophagus, as your gastric acid is not being squeezed by your body fat.
So, for our conclusion is, we must take good care of our health. As long as we can avoid this disease, we avoid it, because this disease is dangerous for our health. As the saying goes, prevention is better than cure.